Okay, Bismillah ar-Rahman ar-Rahim. Again, questions and answers in surgery. Today we are talking about the surgical physiology. We continue on questions on the hormones, endocrinology related to surgery. What is antidiuretic hormone? Antidiuretic hormone. First, is there another name for antidiuretic hormone? Yes, it is called vasopressin. Vasopressin. From where its source? Source from posterior pituitary gland, posterior lobe of pituitary gland. What is the action of antidiuretic hormone? The action of antidiuretic hormone of vasopressin. It acts at the level of renal tubules. Act on renal tubules. Okay, act on renal tubules. Result in constricting urine. Antidiuretic يعني antidiuresis. So it prevent the diuresis. If prevent the diuresis يعني شنو؟ يعني constrict urine. It constrict urine. Okay, because fluid retention. Okay, antidiuretic hormone constrict urine, decrease urination يعني antidiuresis. بعد cause fluid retention. لذلك if we inhibit antidiuretic hormone or there is no antidiuretic hormone شو يصير؟ يصير diuresis. يصير diuresis. Okay. What stimulates the release of antidiuretic hormone? What stimulates the release of antidiuretic hormone? Hyperosmolarity. If the concentration increase, hyperosmolarity. If the concentration increase, شو يصير؟ it release increase antidiuretic hormone. بعد pain, stress, stretch receptors in the carotid and left atrium. Then what inhibit its release of antidiuretic hormone? إذا we inhibit the release of antidiuretic hormone يعني شنو؟ يعني يصير diuresis. فمن يصير hypoosmolarity عكس الهايبرosmolarity يصير hypoosmolarity inhibit the release. Hypoosmolarity inhibit the release of antidiuretic hormone. Okay. What is the effect of surgical stress and anesthesia? ما قلنا stress and anesthesia شو يسوي؟ stress and anesthesia شو يسوي بالantidiuretic hormone? It increase the release of antidiuretic hormone. Okay. Another thyroid hormone which called parathormone. Source from where? From the parathyroid gland. Okay, what is the target of action? Target, it acts on targets. What are they? It acts on osteoclasts in the bone and kidney. Okay, what's the second messenger of parathormone effects? Messenger that it concentrates the effect of parathormone inside the cell. What is it? Second messenger, it acts not only in the parathormone effect in others. Second messenger of parathormone, it is cyclic AMP. What is AMP? Cyclic AMP, cyclic adenosine monophosphatase. Adenosine monophosphatase. Okay. How does the parathormone act? The action of parathormone? How does the parathormone act? First, increase the clearance of phosphate. Increase clearance of phosphate. Thus, decrease phosphate calcium شنو phosphate calcium complexes. ثانيا stimulate osteocyte release of calcium، يعني يسوي hypercalcemia. stimulate calcium release طبعا from bone from osteocyte. ثالثا activate enzyme of the most active vitamin D metabolite اللي هو شنو calciferol in the kidney. Activate the vitamin D metabolite calciferol in the kidney. Activate calciferol in kidney. Okay. Activate calciferol in the kidney. What are the indirect effects of parathormone? اللي هو parathyroid hormone. Indirect effect. Indirect effect through the vitamin D. Through the vitamin D effect. Increase GIT absorption of calcium. يعني increase GIT in the duodenum, calcium absorption. Okay, this is indirect effect via an increase in calcium binding protein. Where is the calcium absorbed? Where is the calcium absorbed? Calcium absorbed in two ways. Active absorption, actively in the duodenum. Passively in the jejunum. Okay? Passively in jejunum. So, what's the effect of hypomagnesemia on parathyroid hormones? The effect what is the effect of hypomagnesemia non parathyroid hormone. Okay, low magnesium level inhibits secretion of parathormone. Thus, what it must replete magnesium for normal calcium homeostasis. Low level low magnesium شو يسوي لنا؟ inhibit parathormone. وبالنتيجة إذا باراثورمون inhibited يعني ما يصير كالسيوم، فيصير شنو؟ يصير هايبوكالسيميا. ولذلك we have to supply magnesium in order شنو؟ supply magnesium in order to normalize شنو؟ normalize calcium metabolism. calcium metabolism. اوكي. قلنا عندما يذكر الباراثورمون شنو يذكر دائما؟ راجع من؟ نذكر من؟ نذكر فيتامين دي. نذكر فيتامين شنو؟ فيتامين دي. اوكي. And is vitamin D fat or water soluble? It is fat soluble. Fat soluble. What are the sources of vitamin D? Two sources. Two sources. Vitamin D2 from milk. Vitamin D2 from milk and diet. Vitamin D3 اللي هو cholecalciferol from ultraviolet light absorbed by the skin. Vitamin D3 أو أحيانا تكتب هكذا زين اللي هو هذا شنو؟ cholecalciferol. هذا تفاعل الالترافايولت لايت مع من؟ بالسكن. وينصنع وين؟ بالسكن. اوكي. What is the site of hydroxylation of vitamin D3؟ هذا يصير له hydroxylation vitamin D3. hydroxylation. وين يصير له hydroxylation؟ الفيتامين D3 يصير له بالليفر اللي هو كوليكالسيفيرول يتحول إلى شنو؟ إلى كالسيفيرول. كالسيفيدايول. كالسيفيدايول وين؟ بالليفر. تحول إلى كالسيفيدايول in liver. أوكي. يصير شنو يعني تحول؟ يصير hydroxylation. hydroxylation. What is the most potent active form of D? Vitamin D. Most potent active form. Potent form of vitamin D. Of vitamin D. Most potent active form اللي هو شنو؟ calcitriol. calcitriol. Okay. Where is calcitriol formed? Other calcitriol most active when? It's formed when? Where? In kidney. Okay, it's formed in kidney from stimulation of enzyme that activated by parathormone. Kidney from stimulation of enzyme activated by parathormone. Parathyroid hormone. What are the major targets of calcitriol اللي هو active form? Major targets. What are the major targets? مثل ما قلنا التارجتس مال باراثورمون اللي هي اوستيوكلاست وكدني. الميجر تارجتس اوف calcitriol bone and intestine. Bone and intestine. Okay. How does calcitriol act? Action of this potent. How does it act? Action of calcitriol اللي هو most active form. It acts on the bone. شو يسوي البون؟ increase osteoclast activity and release phosphate and calcium from bone. Osteoclast activity, phosphate and calcium release from bone. هذا on bone. بعدين على الانتستين شو يسوي calcitriol intestine؟ It act on the intestine. شو يسوي؟ increase calcium binding protein and active absorption of calcium. So بالintestine increase absorption of calcium, phosphate and magnesium. Okay, we will complete our surgical physiology in next lectures. Thank you very much.